Okay, Dr. Dad. So the first question is focused on yeast infections. A lot of people get reoccurring yeast infections. Can you just tell us, like, what is considered a reoccurring yeast infection? What are the signs, like symptoms, and then what should you do if you have reoccurring?
Good question. Most gynecologists, most experts in the field consider more than 4 yeast infections in a year as pathological or more than you should be getting. Now, again, you can certainly have a recurrent yeast infection with two infections per year, but generally we consider more than 4 in a year too much. What causes it? A number of different things can cause it. Number one is when we think of a yeast infection, quote unquote, we're thinking of something called Candida albicans, which is a type of yeast, and it's the most common yeast that causes infections. But there are other versions of Candida that can cause infections, and sometimes those are the ones that are responsible for recurrent yeast infections. The dilemma is you buy something over the counter or even prescription, and it treats Candida albicans, but it doesn't treat the other ones. It may put them down in their activity a little bit, so you think you got rid of it, and boom, the next thing you know, it's right back again. Other things include hyperglycemia, people that like to splurge on high sugar drinks and things like that. Yeast loves sugar. Contraceptives, women on long-term oral contraceptives lose part of their defensive mechanisms against yeast. Chronic antibiotic use. A lot of women use antibiotics for skin control and different infections, and yeasts are considered opportunistic. It means when they get a chance, they take advantage of it and they start to grow. What normally keeps them under control is the normal bacteria in the vagina. But when you take an antibiotic, you kill off the normal bacteria, so the yeast take advantage of that, they're advantageous, and start to grow.